Okay, so the disorder that I have decided to look a little bit more into was dementia, but more specifically alcohol related dementia. Um, just because it hits home for me personally, and honestly, I feel like there isn't enough research done on it that I would just like to learn a little bit more about it. So, first, the pathophysiology of alcohol related dementia is that the brain shrinks due to the consumption of alcohol. Um, it also damages the heart, which then in return reduces the blood supply to the brain and damages the brain cells. Also, when there is an overconsumption of alcohol, there is a lack of thiamine, which is the vitamin B1. Um, the next thing are the risk factors for this. So honestly, the only thing I could find that was one of the biggest risk factors, if not the only risk factor, is regular drinking above the recommended limits. So about like 14 units per week. So it's about 2 drinks a day. I know it does depend on a man versus a woman. There are different standards for both, but it's just basically drinking more than the recommended amount. Now, I did also find that we don't exactly know um what the overconsumption amount is, but it's basically just heavy drinking every day of the week for an extended period of time. So the symptoms of alcohol related dementia, as imagined, they are the not same but very similar to just regular dementia. Um so the ones that I found were staying on task without becoming like distracted by something else. Um Problem solving, planning, organizing your thoughts, organizing just everyday tasks. Um Setting goals, making judgments and decisions, it just becomes very difficult for people with alcohol related dementia. Also, being motivated to do activities that you love or used to love. And then also just a lack of empathy. So, understanding how people are thinking or feeling about a certain situation. For the complications, I didn't find a ton of them, but one thing I did find was that there are two different disorders that alcohol related dementia can kind of lead to. So one of them is often linked with Wernicke's. I can't even say that word. But this is an intense swelling of the brain caused by the lack of thiamine, so that vitamin B1. And then it develops suddenly, so there is no really like symptoms before it. But the symptoms when you do have it are jerky eye movements. You also have like double vision. There's a loss of muscle coordination, trouble moving muscles as well, poor balance, confusion and memory loss, signs of malnutrition. Also, if this is not treated, it can lead to permanent brain damage. But then it can also lead into a different syndrome. So, Korsakoff's syndrome, which is caused by a damage in the deep in the brain, and it affects the ability to form new memories and learn new things. Can be caused by itself due to the risky alcohol consumptions, but it's usually um after the warning keys one. Some of the symptoms are that it's trouble forming new memories and learning new things, There also might be a possible loss of older memories. It's not in everybody, but some people might experience it. Personality changes, confabulation, and then hallucinations as well. Some special considerations about this, the term alcohol related dementia is actually outdated. So it's actually now referred to as alcohol related brain injury or damage. Um, so they just don't use the word dementia just because it can be treated sometimes. And dementia usually is a neurological thing that your brain development and everything, it just can't be treated. But this one might be. Men over actually 45 who have a history with alcohol abuse are more likely to develop it. Also, people between the ages of 40 to 50 are more likely to be diagnosed with it compared to any other dementia. People who develop this most likely have a less balanced diet because they get their energy due to the alcohol consumption. Some different treatment options for alcohol related dementia and the alcohol related brain injury. High doses of thiamine to get the thiamine back up. Also, a big one is to stop drinking alcohol. Taking vitamin supplements again to get that vitamin B1 up. And then also eating a healthier and more balanced diet will help. Prognosis for this, it just kind of depends on the brain damage that they have before. But some can quote unquote recover, but will still have lasting effects from it. Individuals with Wernicke and Korsakoff's syndrome do have a shorter life expectancy as well. And then this is my works cited.